All right, we're going to go to the question part, and what I'll do is I'll start out with asking one of you a question, and the others just chime in as we go along. All right, Dr. DeHaven, the Congressman said earlier that 60% of diseases in humans are zoonotic in nature. What are the current disease trends in animals? And I'm going to define animals as livestock, pets, and wild animals. And then follow-up question that is, what is the most troubling trend associated with animal health?
I think we're all acutely aware of the fact that we're seeing diseases emerge and reemerge at an alarming rate, and as you've indicated and Congressman Schrader indicated, 75% of those diseases are zoonotic. They're primarily animal diseases that have the potential to affect people, whereas the case with H1N1, it's primarily a human disease that has the capability to affect swine and other animals. So we're seeing this emergence and reemergence of some of these bugs that really represent not only threats to production agriculture, but also obviously to human health. Mad cow disease, or BSE, probably being the one that gained the most notoriety, but the fact of the matter is the one that probably represented the least actual risk to human health. Having said that, we're seeing some trends that in fact are a bit troubling. Congressman Schrader alluded to the fact that the world population is growing, and in fact the population today of 6.8 billion will be an estimated 9.2 billion by the year 2050. And if we are going to meet the demand for animal protein by the year 2050, we'll have to increase production by 100%. In order to do that, obviously, we're going to have to maximize the use of limited resources, and in fact, if we're going to meet that demand, both in terms of the demand because of increased numbers of people, but also because as developing countries develop, their demand for animal protein is going up, and that probably is contributing more to the demand than the actual increase in population. It's interesting to note is developing countries become more developed. They want automobiles, they want cell phones, they want pets, which is a good thing for our profession, but they also want more animal protein. And so the fact of the matter is production animal agriculture and not the small family farms are going to feed the world and meet that demand in the future. There is this connotation, and one of the trends that is troubling, that large is bad, that in fact production agriculture leads to more damage to the environment and it can't possibly be humane to the animals. We would argue the contrary, that it's not a factor of size, but rather a factor of systems within production agriculture. In fact, large operations run properly can have a far less impact on the environment per pound of animal protein produced than some of the smaller mom and pop farms that in fact aren't so environmentally friendly. The same goes with animal welfare systems and the fact that it is possible to produce animals in a farm-friendly environment on a large-scale basis, and good animal welfare isn't limited to small production facilities. The other thing that I'll mention is that we are focused on herd health, herd and flock health. And in the public health vernacular, that would be population health. So rather than focusing on individual animals and treating disease, the focus is on preventive medicine, treating populations of animals. Antibiotics are a critical tool in the veterinarian's toolbox in that kind of system, as we work not to treat disease, but to prevent and control disease. And so we would be very cautious about any knee-jerk or shotgun reaction that would take that important tool out of the veterinarian's toolbox, but rather base any actions that we would take on good risk assessment and science-based research.
Oh, Dr. Greger?
I agree that probably the most troubling trend is the industrialization of the food animal sector. Greatest change really in the human-animal relationship in 10,000 years or so since domestication. You know, the number of chickens spread wing to wing slaughtered every day would wrap more than twice around the world's equator every day. But it's not just a numbers game. The way we now raise animals can pose a public health threat. So-called factory farming practices like the cannibalistic feeding of slaughterhouse waste, blood, and manure to farm animals led to the emergence of mad cow disease, bovine spongiform encephalopathy. The subsequent slaughter of cattle, so-called downer cattle, too sick or crippled to even stand, led to our nation's largest meat recall. I'm sure we'll get to the antibiotics issue. just cramming thousands or tens of thousands of animals into football field-sized sheds to lie, beak to beak or snout to snout atop their own waste is a breeding ground for disease. And you don't need to be an infectious disease specialist to realize you put 1,000 people in an elevator and someone sneezes, you got a problem.
Any comments? Dr.
Well, I just mentioned back to one thing that Dr. Haven mentioned, the assumption that big is bad. If you look at the data from FSIS, the number of plants that have violations for salmonella levels above the accepted level, that happens more often in the smaller facilities. They have, FSIS works hard to help those people do their job better, but the big folks have PhD scientists, microbiologists on their staff. They have extensive training in animal production. Now, to relate to something Dr. Greger said, makes all of us uncomfortable to think about crowded conditions. And if the conditions are so crowded that the animals are unhealthy, then that changes. Producers can't survive by treating the animals poorly. But keep in mind, the alternative to having this X number of billion animals in controlled environments, the alternative is to put them outside. And what happens when you put livestock outside? They interact with the environment. As Dr. Dunham said, the microbial ecology, they overlap very much. So in pork production, we've virtually eradicated two important zoonotic diseases, toxoplasmosis and trichina, because of indoor confinement housing. So we have to be sure to separate all the pieces. Each bacteria has a different ecology, and the consequence of one management change may be different for that agent versus the consequence for another. So unfortunately, it's not real easy to make blanket assumptions about management practices.
And if I could just build on what Dr. Hurd said, we as pork producers have a moral obligation to care for each and every animal each and every day. And that, as Dr. Hurd said, is it's not in our best interest to crowd animals together and not treat them humanely. That is not our business. On our pig farm, when I go back home, it's my job to make certain that every pig is healthy, that every pig is cared for, and that every care has the needs that it needs, like food and water. We made the decision to move our pigs indoors, as Dr. Hurd said, for public health reasons, but also for worker safety reasons. My parents needed to move those pigs indoors so that they weren't getting beaten up and that we were able to care for our animals and give each animal the individual care that it needs. So I think we need to be very careful that we, as Dr. Hurd said, we look at everything individually, because we have virtually eliminated two important zoonotic diseases and two foodborne pathogens from our industry by being able to care for our animals.
Thank you. Just want to make one comment, and that is just for clarity. Within the Center for Veterinary Medicine at FDA, the one thing that we do not approve are vaccines. That's done by USDA. So together we team tag on hopefully having enough tools in the armamentarium of veterinarians to choose from in order to protect animal health. Which, as you mentioned with the question, I think we're also, as I said earlier, we're living with animals. Our pets also expose us to diseases and vice versa. And at the same time, when you think about production agriculture internationally, you've also seen the fact that, again, people live in very close quarters sometimes with animals. And so this is the heightened awareness through surveillance and documentation of what are we seeing, because it goes both ways. And we talk about animal diseases as zoonotics coming to people, but we are still animals, and so it goes both ways. And some of you may not even realize that if you have measles and you're then exposing yourself to non-human primates, you'll actually infect them, and they don't have the same reaction. It can be serious and fatal for them. So again, a heightened awareness of what goes back and forth and how we can team tag addressing these issues. We've moved into our populations with deer, and we have Lyme disease infecting us, infecting our pets, infecting them, and that can be very, very serious. The challenge is, what are we developing as a drug or an interaction with a vaccine to intervene on that, to be able to give us a tool? And this is the challenge. And when we do develop these products, how are we using them? And I, again, like what you're hearing across the table, to have the drugs overseen by veterinarians when it comes to animal health is quintessential. The same thing with physicians overseeing human health.
Actually, from your last statement, I asked Dr. David, what role does the veterinarian have to control and prevent disease trends?
I'll just reiterate some of the comments that I made in the past relative to the role of veterinarians to control and prevent disease. It's interesting that our public and the media, members of Congress in fact, typically associate veterinarians with control or with care of pets, and clearly that's an important role that veterinarians play. There's no one more important to us, perhaps other than our children, than our pets. And we've got data to show that the bond between humans and their pets is stronger than ever. So that is an important role, and I don't mean to diminish that. But at the same time, I think there's a lack of recognition of the important role that veterinarians play in agricultural production and food safety. We do, as I mentioned, practice in that regard. We're practicing herd health, where the focus is on not treating disease, but rather preventing disease. And that there are various tools in the toolbox that are critically important if we are going to produce healthy animals that we need at our disposal. We at AVMA would be the first to suggest that use of antibiotics in particular is crucial, that we use them judiciously in a way that maximizes the benefit, at the same time minimizes the risk both to the animals and to public health as well. There is this, I think, misperception that by using antibiotics as a preventative that we're overcoming bad management practices, when in fact part of a good management practice is the judicious use of antibiotics to keep animals healthy. And again, as has been said by many of the speakers this morning, healthy animals produce healthy food. So the challenge, I think, for us in the future is, as we see this emergence and reemergence of these pathogens that are zoonotic in nature, are we going to be able to produce new tools that will allow us to continue to practice that herd health preventive medicine approach in a way that is friendly to the environment, doesn't jeopardize public health in doing so, but yet utilizes new technology. Congressman Schrader indicated, and I agree with him, that perhaps genetic manipulation, gene therapy, those kinds of technologies that are just now being developed, in fact, may be the way forward. But in the meantime, we need to be very careful about any restrictions that we would put in place that don't carry with them an appropriate risk-benefit analysis, and that any restrictions would be based in well-founded in science.
I would like to build on that because I think it's very important. I mean, the role of the veterinarian is truly quintessential, and that's something we do embrace as you're hearing across the table. I think how we have access to the drugs that are approved, having those under the supervision, oversight of a veterinarian is quintessential, and that's something we do all embrace. And within the FDA CVM, we absolutely do embrace that veterinarians are the ones that would be able to work with and diagnose and treat animals. But at the same time, treatment, control, and prevention is key, and we need to sustain that as something we do embrace, preferably with a veterinarian oversight. And this is an area that now is being looked at, I think, quite closely. Part of the problem that you're often hearing is the fact that there are some particular antimicrobials that were approved a number of years ago, long before we even talk about antimicrobial drug resistance. And those way back when are often over the counter, and ergo people are looking at those right now to see how they're being used. The scenario is something that we all embrace, judicious use of an antimicrobial. The National Academy of Sciences just 2 weeks ago had another meeting on this. There's been many, many meetings in many forums on this whole area. But it's coming down to one thing. In this day and age, we have very, very, very little in the pipeline coming forward. Ergo, we would lose on the health side for animals as well as for people. And the challenge is out there. How do we encourage and develop new products? In the meantime, it behooves us all to use these very valuable products as judiciously as possible. And that is why I really do feel it's so important that we have veterinarian oversight and involvement. They're the ones that are able to set up the larger programs, oversee. It doesn't mean that a veterinarian has to see every single animal, but they have access to herd health records. They're aware of how things are being maintained. And with that oversight, they're then able to give their training as to how programs should be followed through. It's something we really, really do embrace. The issue of some of these other antimicrobials, as we mentioned, have often been cited as, well, they're enhancing growth promotion and feed efficiency. And that's all that may be on a label. And probably way back then, that was true. Why? Because that particular antimicrobial was doing what an antimicrobial does. It's treating a pathogen, or it's keeping a pathogen at bay, and the animal's not developing disease and not getting sick. That has now come forward in this day and age, as I mentioned, without having anything in the pipeline. Because we're seeing resistance developing in different areas, as we see it impacts human health and it impacts veterinary health. Veterinarians need these tools to work. We have to use them judiciously. And so part of this is re-examining some of those older drugs and many times being able to correctly label them. So you have the pathogen identified, you have a dose range, but you have it under the veterinarian oversight. And it would be wonderful if we could, together, embrace that and move forward. It's not going to happen overnight. I think it's something we need to work towards, to brainstorm together and to get there. So we could phase this out as far as an antimicrobial for pure growth promotion feed efficiency and bring it back under veterinary oversight and also bring back then how are they being used and what they're being used for. Because it's very, very important that we also prevent, as you've heard, disease from breaking out. You need to keep healthy animals if you're going to have a safe food product. You need to keep these antimicrobials working so they will treat the disease or prevent a disease or control a disease. And this is for veterinary medicine as well as human medicine. And I think the more we talk about this and bring the science to bear, identify the gaps where there are gaps, and continue to help the industry be able to develop new programs and new procedures. Gene therapy is surfacing. We're seeing this right now. There was a model that was done with USDA, for example, with a dairy cow, Jersey, who had gene therapy so that she would be resistant to Staph aureus mastitis. That's great. She doesn't need an antimicrobial. She doesn't have the pain of mastitis. She's healthy, and the product of milk is healthy. That's a research model. It's not out in the market. But it's the idea that the more we involve each other with research, we can advance what we need to advance and develop new tools and new ways of addressing these challenging issues. And that's an exciting part. And that's why bringing the best of the best together from the universities, from industry, and from government, we can problem solve. And it's going to take problem solving together to move all of this forward.
You touched a little bit on the obstacles that veterinary has to have in front of them. Any comments on what are the major obstacles? Is it political? Is it social? What is it?
Obstacles as far as practicing veterinarians in the field?
Yes.
Well, the number one obstacle, and I think it needs to be kept in mind when we talk about the veterinary shortage out in the countryside, is whether or not a veterinarian can make a living out there. The reason a lot of these areas are underserved is because there's really not enough work for them. And related to that then becomes the question is, depending on what level of veterinary oversight we need, it may be 200 miles away to get the nearest veterinarian. So as Dr. Dunham mentioned, we can't expect that a veterinarian is going to see those animals every month, say like they require in Denmark. All animals have to be seen by a veterinarian every month before you can write prescriptions. So that's one of the biggest obstacles. It's just their ability to survive and run a business in certain parts of the country.
All right, Dr. Dunham, the federal agency is doing enough in preventing consumers from animal health-related diseases, and how?
Within the FDA, as I mentioned, we have both physicians and veterinarians, so we're out there monitoring the health of humans and also animal health. And one thing that we are doing very specifically when it comes to food animals, we have the National Antimicrobial Drug Resistance Monitoring System, and this is done in concert with both USDA and CDC. It's one example of a way in which you can enhance surveillance